And if thank you, Julia. And if you just heard Emma, please do enter your name and facility in the chat. That's how we'll do attendance today. This discussion this afternoon is coming on upon the heels of us providing an important document this morning to all of you. So you are all in Cohort 1 carceral facility for the Medicaid Reentry demonstration initiative. And we were able to get out this morning, thank you, Emma and team, the capacity building application. So this is the second milestone in your cohort. You all joined through the first milestone, which was the intent to participate letter. This is a more substantial piece of work, and it also offers more funding to help you prepare for the July 2025 implementation, which is why I'm glad you all joined today. This is a forum for the carceral facilities. If you're one of those facilities, please note that we will have representatives from the accountable communities of health. I hope you recognize some names there, as well as from our managed care organizations. They want to be in listen-only mode. Of course, they want to hear the discussion, want to know what is concerning you. So please note that they'll be on this discussion, or at least on the forum today. And before I hand it back to Emma, just a reminder that this is a terrific way to stay in touch with us, is participating in these discussions, but also we've got the mailbox, and you probably saw that in the email this morning. There was a link to it, as well as a link to our reentry page. So yes, ask us questions today, but please continue to correspond with us through that reentry mailbox and check out the reentry external page as often as you can. We are updating it quite a lot lately. So looking forward to a rich discussion today about the capacity building application. It's again our second milestone and a very good start to this whole process. So Emma, please back over to you, and looking forward to the day.
Thank you, Michael. All right, can we go a couple slides? I think we're a couple slides in, so this was just our high-level agenda. And then I'm gonna do a full walkthrough of this capacity building application that we released this morning. And I want to start by asking, does everyone know what we're talking about? Did you receive an email this morning with some links to the application materials? I'm just looking for yeses in the chat or thumbs up via the reactions. Okay. Sounds like there's some folks that we need to follow up with, which is really good to know. Maybe Mariah, could you see the no's that are coming through and just forward the capacity building application? Thank you. So I think we were hoping, I know it came this morning, we were hoping folks might get a chance to at least take a quick look through the materials. And actually, I'm going to back up for a second and say everything is currently live on our website. So let me pull that link up really quickly and put it in chat. And so folks that have not seen the application, I'm going to give you the link. Let me just, if you scroll down to the Cohort 1 page on our website, oh, it's not there right now. Okay, it was there very recently, so unless I'm doing something wrong, which is very possible, it should be posted on our website. So I don't know what I'm doing wrong, but okay. We're gonna just get emails forwarded to folks that are saying they don't have them. So we'll start with that. But for everybody that does, I'm glad to hear that you do have the application, and I'm gonna just keep going. Sorry, everybody. Next slide, please. All right, so we've been talking a lot about this phrase, capacity building application. What is that? It's the second milestone that facilities have to meet to participate in our reentry demonstration initiative. And so the application will be due back to us on October 1st, which is a Tuesday. And when you have your application approved, it will be associated with 40% of your funding. So quite a lot of funding associated with this milestone. And what is in the application? It is a set of attestations. It's a template for requesting your capacity building funds. It's your budget template. And then there's an optional space for you to provide us information on your providers who would like to use a free claims clearinghouse that will operate as part of this program. And then there's another optional piece of the application, which is requesting IT infrastructure dollars. And we'll talk in more detail about these pieces. Oh, thank you, Mariah. It sounds like some folks are coming over from Teams. Let's go to the next slide. So I'm not going to go through this in as much detail. We pulled this directly from the introduction of the application, but we essentially have 7 high-level requirements for this program that you can see all of the requirements on that attestations page, which again, we'll talk more about. But the requirements are no cost to individuals. So all of the healthcare services, and in particular, all of the communication around healthcare services has to be provided at no cost to individuals in Apple Health. Staffing and governance structure, you need to have staffing and governance to support the program. Apple Health screening, application support, suspension, and release date notification. You need to be able to assist folks with screening for Apple Health, do application support, be able to send information to HCA that would suspend their Apple Health, and then do a series of things related to release date notifications. So I guess that one's a little bit more self-explanatory. Provider enrollment and billing, it's our 4th set of requirements, and that is essentially folks, your providers need to all be enrolled and able to bill Medicaid. And then again, we will be supporting a free claims clearinghouse, so we can talk more about that and how that can help with billing. Next slide, please. Feel free to stop me in the middle of anything. I'm happy to answer questions as we walk through. So our 5th requirement, you need to provide the case management service. So in particular, screenings and health assessments to determine health needs for each individual. Support for medications, you need to be able to provide medications for SUD, as well as 30 days of meds upon release. And again, we have more specific requirements in each of these sections. And then there's a series of what we're now calling additional services that are optional to provide. You do not have to complete the section of the attestation form, but we hope that you do, or in the future, you will offer these services. So at a high level, this is the seven requirements. Let's keep going. All right, so there are a number of different materials you received today as part of your capacity building application. And the bulk of the content is really in this attestation section. So there is a series of attestations within the 7 high-level topic areas, and each facility needs to go through those attestations and attest to whether they will be able to meet the requirement by go live, or if they need technical assistance to meet requirements. And so we're more than happy if you want to select both, like you have a plan for going live, but you need help with this specific thing, we're happy to also entertain checking both boxes. And so how will we use this information that's returned to us? So we are going to use the information that you submit to us in that attestation form to better understand the baseline capacity of each facility to meet our program requirements, and also to understand the types of technical assistance that are needed at each facility to be able to go live. And we're going to talk through a lot of different free technical support activities that we'll be able to help you with as part of this program. So you go through this whole attestation form, you select the most appropriate category for your facility, and then within each of those 7 sections, we're asking folks to describe the technical assistance needs that they have. So I want to think of an example, but I didn't plan for this. If you're new to the provider enrollment process and you think that will be in place by the summer, but you really just need to understand it better, I think you could write in and say something like, need an overview of where to submit this form, need an overview of the steps of the process. That's just an example of the sorts of description we're looking for in that technical assistance section. I'll keep going, unless there's questions. Well, let's keep going. So the next big piece of this application is a budget. And As we said earlier, facilities can receive up to 40% of their total spent like funding for this program when we accept the capacity building application. But 40% of what? As you know, there is a top amount of funding that each facility can get depending on their size. But you do need to actually request those funds, and you need to request funds within eligible expense categories. Some of this information should be old because it was in the overview document that we released a few months ago. So the budget template will ask you to detail what you will spend your capacity building funds on, and then you just submit that to us. And we're going to go through that budget to make sure that every expense you requested is an allowable expense. And we're actually also going to look for any costs that we think could be delivered free of charge from HCA via our technical assistance that you would not need to separately pay for. And so if we identify something like that, we'll get back in touch with you and just have a conversation about what makes the most sense, because we want to make sure that you are able to preserve those funds for the highest needs that you have. And just one other thing that we wanted to talk about budget-wise. So as we've talked about in the past, there are two pieces of the budget. One is the capacity building funds, and then the second piece is this IT infrastructure budget. And we were going to ask for the IT infrastructure budget back as part of this milestone 2, but we are fully pushing that to milestone 3. And that's because we're still waiting for a little bit more information on our free EHR program that we're implementing as a department. There might be, I think we've talked about this, there might be some low dollar costs associated with that. And we want to make sure that you can include those costs in your budget. And so that's why we're suspending the IT infrastructure budget piece right now. However, I'm assuming many facilities have already thought about a lot of spending needs in this category that they'd like for go live. If you have a specific need, you are welcome to fill out that optional IT infrastructure budget. We are recommending that facilities that do not have an EHR preserve at least 50% of their budget right now, like today. That might not be the case in the future, so that we can just have space for any EHR associated costs. So we're also more than happy to answer questions about that. All right. Next slide, please. And so how will we approve the capacity building application? We're really looking for completeness here. So facilities have to complete all of the attestations. We're going to look and see that you have those narrative statements filled out if you identify the need for technical support. And then we're also looking for a budget that includes allowable expenditures. And then again, we'll follow back up with you if we have a concern about anything. And I think I already talked about this. We might come back to you if there's something we think we can provide to you for free. So we're just hoping you fill it out. And I think it's going to be a process and a conversation to get that done. Next slide, please. So I think you probably have a lot of questions if you're looking at that attestation form. There's many questions in each of those 7 sections. You're probably thinking a lot about, how does my facility do this? We need all the support to get this done and to be able to go live. We are very much anticipating that. I think please feel free to send questions to us. We are scheduling some group meetings we're scheduling some group meetings in September to address questions. And I think the goal is the first and second week of September, we will have these group meetings. We are still talking about what the structure for those meetings should look like. So we're going to wait to see what types of questions we get, and that might inform the topics that we choose to focus on and how we hold these meetings. So more coming on that in the future. And then again, we'll just start having conversations about the technical assistance that you need. And so one thing that we wanted to talk about, not in the application, but we wanted to bring it to everybody today. I think we are expecting that folks are going to look through all the requirements and think, wow, this is a lot. My facility has to do a lot. It's a lot to do in 1 year. And that is totally okay. And so we just want to open the door to, if you go through the requirements and feel like it's not going to be doable for your facility in a year, we are more than happy to talk about shifting start dates. You can go live with cohort 2, you could go live with cohort 3, or you could even go live in August of next year instead of July. We're really trying to be as flexible as possible and want to meet you where you're at. So please feel free to initiate that conversation with us. And then the last thing I'll just say is that we have a readiness review coming in spring 2025. And so what is the readiness review? We have a paragraph on this in the capacity building application. It's going to be similarly a set of attestations where you say my facility is now ready to do all these things by the summer. And then separately, it's going to be some narrative questions where we ask facilities to describe how they're meeting the programmatic requirements. So we've been getting a lot of questions about what will the readiness review include, and we just want to make it very clear that nothing in there should be a surprise at all. It should look like the requirements that we have today, and it should look like facilities needing to describe how they will meet each of the requirements. All right. Next slide, please. I think I'm turning things over to Mariah to talk more about the technical assistance that we have. But I did want to just pause, and that was me doing a lot of talking. Are there any immediate questions? All right, maybe we'll just keep thinking about questions, and I'll turn things over to Mariah.
Thanks, Emma. Yeah, so we just wanted to go through kind of the free technical assistance that HCA has capacity and is ready to provide. So claims clearinghouse, this is going to be anything to do with claims and billing support, technical assistance in terms of meeting really any of the programmatic requirements. That includes things like help identifying care providers, help identifying like community-based organizations, lots of support for provider credentialing processes. We're going to be doing assistance with prior authorization and also support for individuals who would like to request an HCA appeal or any kind of like grievance process. I think kind of the big takeaway message from all of this is really we want to be here to support you. And so if there are barriers that you are seeing or there are things on this list that you're not saying that you feel like you're going to definitely need help with, please identify those. And we're here to partner at every level that we really can. So we will do our darndest to move any barriers that are in your way for participation. And I think I'm going to turn it back over to Emma for a second, but I believe the next step is contracts. So it should be Teresa.
I'm actually wondering if Teresa might not be on yet. Mariah, would you be able to cover the contract slide? Sorry.
Yeah, no, absolutely. Okay, let's go to the next slide. So at this point, we have sent out all of the contracts to facilities. Thus far, we have received 12, and actually that was 12 as of this morning. So as of lunchtime today, I think we're up to 14 signed contracts back. And we also have had 3 facilities who have already submitted their A19 forms, and those were, that's the form specifically for payment. So there was kind of that 2-step process where you had to submit the contract, and then you also had to submit the vendor identification in order for payment. So we have 3 facilities that are kind of already on the way for being paid for milestone 1 and are being set up. Back to Emma.
Thank you. And I'm seeing one direct message about a contract question, and we heard 2 contract questions at the beginning. So maybe let's hold. Actually, the one in chat, maybe I'll read out loud because I think it might be something that we can answer. But if you have an individual contract question, let's hold until the end and we'll let folks drop off and then can talk through some of those. So there's a question about, does the county official need to sign on the first page and page 23 of the contract? I think that's the whole question.
So I'm back. I was on the Teams meeting helping people get here, so apologize for being late. I think it depends on what I'm happy to talk to you, Amanda, or is this Amanda question? Whoever just asked that question, I'm happy to work with you directly. It is the best way, and I don't know if you said this, Emma, to be able to actually answer your question quickly. The best way is to send it to the HCA reentry mailbox. We check that a lot, and there's multiple people that check it, and we can get it faster. We can get your answer faster because we triage those than if you send it to one of us individually. Feel free to CC one of us individually on that, but it's really helpful. We can move much faster if you send it to that. So that's number one. And then number two, I'm happy to look at what's been asked in the chat and work with you directly. So Amanda, I see your question. Who is our point of contact if our county lawyer has questions? The HCA reentry box is great. We send those directly to contracts if if it's a contract question, and if it's more of a general MTP question, then that's something our team answers. So that's what, and then we're tracking those questions so that as we get them, we put them in the FAQs, and then more of us have answers to those questions that come up. So Amanda, if you put it in that section, we'll get the county lawyer and our contracts person connected directly. And actually, as of this morning, I think it's more than 3 facilities that have submitted their A19 for payment, and we're working that through as well. I think we actually got a few contracts more signed today. I think I saw at least 3 or 4 come in as of today. So appreciate all of you doing all of the work that you need to do to get those contracts executed. So thank you.
Thank you, Teresa. And so I see another question about our IT infrastructure budget. And so is Epic going to be included in the IT budget, or is that a separate line item? So the costs of the EHR program that HCA is sponsoring will not be on you. There could be at all. So it doesn't need to go into your IT infrastructure budget. We will not be putting a fixed dollar amount into your IT infrastructure budget, like in a template or something like that. However, I just want to say, however, I think there are some low dollar ongoing costs, and I think there are some optional, basically like training activities that we probably will highly recommend folks do if they choose to move forward with the EHR program that HCA is doing. And we just want to make sure that you're able to accurately budget and account for those activities. And so that's part of why we're holding off on asking for that IT budget at this time. So not a quote right now. I think I got every part of that one. Thank you. Next slide, please. All right, so just wanted to talk a little bit about our next steps, and then we're just going to do a Q&A for a while. So just please send us questions. I think the big takeaways here are please send us questions. Expect some check-ins coming soon. And then we're still working with everybody to sign contracts and get dollars out the door associated with your ITP. Next slide, please. And so I think we just have some additional information in this section. Are there any questions about the capacity building application? Thank you, Teresa, for putting our email address into chat. Okay, questions about screening folks for Apple Health and getting people signed up. That is a great question. So I think the short answer I will give to you on the call is that there are community-based navigators who are free to work with, who we're recommending if facilities don't have an existing process that they do connect with these navigators and have a process for running folks through them to get healthcare. So I think that is a really great question. And I would recommend that you write that into the technical assistance section of, I need to better understand this process. I need to better understand who we need to work with. Okay, no navigators in your zip code. We'll figure out an alternative. What facility are you with? Mhm. Any other questions today? I think let me just flag a couple other things we're thinking about. So two areas where we really feel like we need to provide some additional detail are the provider enrollment process generally for in-facility providers that are likely new to Medicaid. And then similarly, the 30 days of meds at release requirement. So just what are we going to do in terms of getting you more information on those two topics? For 30 days of meds at release, there are some facilities with some really creative solutions across the state. And we're just hoping to do a webinar where folks will present their plan for how they're going to meet this requirement and just talk through that and hopefully give everybody some ideas. And then on provider enrollment, expect another learning series coming soon. I think we're aiming for September to walk all providers through, or really facility staff, whoever wants to be there, through the provider enrollment process and just give all the background information necessary to get that process off the ground. So those are kind of like two outstanding technical assistance learning webinar type activities we're planning to do. And then as we receive responses back from the capacity building application, we will plan a lot more technical assistance to meet everybody's needs. Great suggestion from Jessica in chat. There's a question about collecting questions, and we do have an FAQ that needs an update at this point. I think that as part of this process, we can start putting our answers into the new version of the FAQ. Any other questions?
I had some questions. We're trying to get our contract signed through Whatcom County. We actually have a county council meeting tonight. And some of the questions that came up, I think one of them you might have addressed is they were concerned about the lack of it specifying in the statement of work up to amounts. But I think as long as what I'm understanding is if it's in the budget and it's in the budget as to what we need, that's what the work up to amount is. Is that correct?
Yeah, so Teresa, I'll let you give a formal response to this.
Yeah, so the up to amount is based on your tier and is based on the percentages in each milestone. So it is up to, and your budget will essentially articulate how much of that you are planning to spend based on what you are going to create with your budget and your implementation plan.
Perfect. And then the other question was, is if there's consequences if we don't meet the milestones or the mandatory services.
I'm gonna let Emma answer that one.
Emma, do you want me to take that one?
Very good.
Hi, thanks for the question. We are not looking to have consequences. And I think what you're probably referring to is if you receive the money and you start working towards implementation, we don't have any plans right now to have there be consequences. Our goal is to get you there. We're going to work with you. As Emma was saying, if we need to work with you in cohort 1 so that we can say implement on July, that's fine. If we need to implement, say, August, September, October, that's fine too. We can move the date out. What we're going to do is always work with you through the whole thing. We want you to stay involved, stay with, even move to another cohort 2 or 3 if you'd like. We have ACHs online here and as well as MCOs that we partner with, so we can help you with that as well. So at the moment, no, we don't anticipate having to do any kinds of looking back on things. We're looking forward. We want to keep going forward with you. And these meetings are to make sure we all get there together. We're going to work together with you. And I think there's going to be a high incentive to join the program. And I think there's going to be a way to get everybody to a starting line.
Thank you so much. Their next question was if the services have to be over and above what we're currently already doing. So if we're already implementing some of these things, do we need to go above and beyond, or as long as we're meeting the requirements, is that okay?
Want me to take this one? So you need to meet all the programmatic requirements to go live with this program. And what does going live really mean? It means that you can start receiving Medicaid reimbursement. So I think to the extent that existing health services meet all of our requirements, that's great. I mean, that's a really good place to be. And I think we'd love it if you could share some of what you're working on right now so that other facilities could learn from you. But I think, yeah, to be able to go live, you just have to meet our requirements. And then the hope is that everybody will start expanding services.
Perfect. Thank you so much for all of your responses.
Of course. You know, I'm seeing a question in chat that I want to comment on. So I think you're going to think about this not just in regards to screening for Apple Health, but also in regards to providing medical services, including case management. So what happens if you only have somebody in a facility for a very short period of time? I think the short answer that I will give today is that the expectations that we have as HCA will vary depending on the length of time that an individual is in a facility. And I don't have a ton of extra detail on this today, but we will come fall, and we're really trying to be very reasonable here. So for instance, for case management, or maybe starting at the beginning, I think an expectation would be that shortly upon intake, folks are enrolled in Apple Health, and then case management activities will begin. And so that process can look like a couple of days of work. And so our expectation is that facilities do what's reasonable within a period of time. And again, we'll have more details on this coming in the fall.
Emma, I'm seeing a question from what I believe is Puyallup Corrections Center, and they're asking about the required process for screening for Apple Care. I misunderstood that. I thought they were asking about navigators. I know we do have some requirements. Can you talk a little bit about that? So I think my response was wrong, was why I'm calling it out.
We did talk about that one maybe right before you hopped on.
Oh, perfect. Okay, great.
Sorry. But no, I think you're right. Any other questions about the requirements in particular today? Any other thoughts? So for facilities who have had a chance to look through the requirements, and I do think everything's live on both tabs and Google Chrome. So on every version of the website right now, the material should be live if you haven't seen them yet. Under the Cohort 1 tab, any thoughts from your facility around requirements that are confusing today, or areas of support you think that you might need? Just anything you have, we'd love to hear it today if we have some extra time.
Hi, this is Jody from Clallam County, and I just wanted to clarify what I thought I heard you say was that we do not need to include the cost of Epic as an estimate in our IT budget. Is that correct?
That is definitely correct. You don't have to fill out the IT budget at all right now if you don't want to. We're saying that if a facility has a specific need that they want to submit to us, and then we can provide funding on a case-by-case basis, assuming it's an allowable expense. It's an optional task though at this time.
Okay, thank you.
Other questions or feedback today?
Yeah, Emma, I got a question for a direct message from Carrie Weber. Is this federal money? If so, what agency? Social Security Administration, question mark. My auditor is needing the ALN number. We submitted an email to the inbox, but someone else might have had the same question.
Tracy, do you want to
So,
take this one?
so this is confusing, and I did respond to somebody this morning about this exact question. So it's a grant, which means it does not need, normally there's a section in the, I don't remember what it is, but there's a specific section that asks for the specific number. We don't have that number. The number that we have is a project number because it's not what normally folks think about when you get funding from the federal government. So because it's a waiver, not a grant.
It's a waiver. Yeah. Thanks, Teresa.
So, sorry, Michael, were you talking?
Yes, I was just going to, you're saying it's a waiver.
It's a waiver. It is not a funded grant. So yeah, I think I transposed those words. So yes, I will put the number that you need to actually say in the chat. We also will put it in the new version of the FAQs because it's the second time I've gotten that question. So Carrie, it's a great question. And again, we understand that they're reading it looking for the number, but it is a waiver, not a grant. That should be enough. But if it isn't, I'll put the MTP waiver number in the chat, which means we might need to keep this line open for a minute while I do that. But likely if you have the question, someone else does too. And there's a question in the chat that we actually put the waiver FAQs also in the chat.
And they're on our Reentry website page. I'll send the exact link in a moment. And just an FYI that we do need to go through and we definitely need to do another round of FAQs. So that's coming soon.
And I just put the project number in the chat. And again, it is not a grant, it is a waiver. So I don't know that, Trudy, I see your question. So do carceral facilities provides naloxone now to individuals with history of OUD upon their release as clinically indicated? Will the HCA be providing that? I could guess at the answer, but I don't know that I want to guess. So we'll get back with you unless someone has the answer that's on the call.
And I can take this one, or Arthur, actually, if you would prefer to take it.
No, I think taking that question back is probably the right thing to do. Yeah.
Great. Thank you, Arthur. And that's maybe what we'll do is we'll take that question, put it on the FAQs and answer it on the FAQs as soon as we have that answer. But we'll respond directly to you, Trudy.
And I would just quickly say that it should be a billable activity, but let's take that one back.
Mm-hmm.
Okay, great question in chat. Can county and municipalities partner to share resources if all are enrolled in cohort 1? Yes, we would love that. We think that's a really good strategy for getting this done. If facilities want to work together, especially maybe in rural areas where they might need more support, I think that's a really great idea. We do want to offer that we also have our accountable communities of health who are on the call today and can help facilitate those conversations in their region. And then I think we'll also be working with everybody on connections to health-related social needs services. So that's just another opportunity for folks that you can lean on to help make some of those partnerships happen. Actually, Arthur, would you like to take the case management question?
And then there's also a Liz Baxter question above Travis's. Go ahead, Arthur.
Yeah, I would say that's the intent, is that case management services would be billable, but they need to be billable through the provider, right? So typically RNs can't submit bills like that, and they need to flow through the provider. So yeah.
Lisa, I'm not seeing the Liz question for some reason. Do you mind just
Sure. I mean, Liz, you can come off mute, but an observation when someone asks the question, oh, wait. So are the counties, okay. So I think does there need to be clarification for replacement dollars for current funding? If you are receiving funding, currently receiving funding and you're using waiver dollars, I'm not sure I understand the question. So I think I understand what you're asking. We'll put that in the FAQs, which is if you are using waiver dollars to replace current funding, what might that mean? And Michael, you're smiling. I think you've heard this question before.
Yeah, I think we should respond to it, but let's discuss it right now, Teresa. The waiver funding for the capacity building application is to prepare to implement the Medicaid reentry demonstration initiative. So the expenses have to be in the categories that Emma was mentioning at the beginning of the meeting, and they have to be for preparing and implementing, planning and implementing this particular waiver. The funds cannot be used to replace other expenses that a carceral facility might have. And we'll clarify that in the FAQ. And if the question was referring to a different context, go ahead and put that back into chat, please, or feel free to come off mute. Thanks, Teresa.
and I'll just do one flag for ACHs and MCOs. If you have questions following this call, please feel free to send them to your separate inboxes and we'll handle questions that way. So thank you.
So along the lines of what you just said, Michael, if you're expanding or if you're expanding the existing services in order to implement this, then the expansion piece of those services, like if you're, say you have a nurse practitioner and they're going to do additional time doing this, then that would be acceptable, but not what they're already doing currently.
I think that's a really good example, Christine. Yes. And if you feel like something is falling in the gray areas, please please contact us right now because it really helps us think about how to work best with you. And also, I think would really help. We can give you some advice about what would be, right to ask for in this capacity building application, and what probably would fall outside the lines. But if it's looking like it's in the gray area, please contact us because I think we would like to help you out and make sure that if there is something you're doing and for planning and implementation of this particular initiative in the waiver, we do want to support it. And then we want to make sure that we stay within the sideboards that our federal partners are giving us. So thanks, Christine.
I'll just flag that Appendix A, which is not the best name for that, of the budget template has a list of allowable expenses. So if you have questions about whether you can spend your capacity building fund dollars on something, please take a look at that list. And that has the most up-to-date information on where funds can be spent. And then just want to do a quick flag that for Medicaid reimbursement, any service that's one of our services can be reimbursed through the program. Other questions?
So I just want to make sure, Nicole, that answers your question. So the waiver cannot supplant other already funded activities and programs.
Yeah, I think I was stemming off of kind of maybe what Liz was asking, or I'm assuming that was the direction she was going in on supplanting already, because some of the folks might already be doing some of these activities. But I think you did answer that also, Emma, by pointing to the allowable expenses.
Great, thank you.
Any other questions today? Otherwise, it sounds like we might have a few individual contract questions that we can ask folks to stay on for it. But any other questions?
Hey, Emma, this is Laurel from Molina. Just to clarify, did you say it was acceptable for MCOs and ACHs to submit questions through our respective mailboxes as well? I wasn't sure if I heard that correctly.
Yes, please, please. So sorry to be really heavy-handed here. We're trying to preserve this forum for facility questions, and then other folks, so MCOs, ACHs are going to help us support this program quite a bit. But just for the sake of this forum, let's take questions to, you can send them to the reentry inbox and we're happy to answer that way, but otherwise via your standard program officer type route for questions would also work. Thank you.
We've got another question in chat. A person is booked at midnight, bails out by 5 a.m. And then never returns to jail. How will facilities meet that requirement?
That is a great example of what is reasonable to do within a period of time. And so for things like provider enrollment, for things like case management, certainly for meds upon release, we're going to provide more detail on that in the fall. So I don't have a direct answer today, but I think there's going to be a degree of reasonableness that's applied to these situations. Any other questions? I think we can give people some time back. So thank you for your time today. We're here to answer questions. So please feel free to start sending them to us when you have them. And if you have a specific contract question and you want to stay on and you can talk to me and Teresa and Mariah, we'd be happy to do that. So thanks everybody. Happy Tuesday.
Thank you.